All right, we're good, Kristen.
Okay. Hey guys, this is Kristen Hood. I am here today welcoming you to my home office. I am proud to introduce Dr. JJ from Nemours in Wilmington, Delaware. We're here to just talk today about telemedicine and really talk about how to prepare for these visits so that when you do meet with your doctor through a telemedicine conference, like a video conference like we're doing right now, you can be prepared and get the most out of your visit with your doctor, and the doctor can also get the most out of the information that you can give him or her also. So, a lot of this, first of all, I'd like to introduce Dr. JJ. He's from Nemours, again, in Wilmington. He's the chief of pediatric nephrology. He's one of our NephCure specialists. So welcome. Thank you so much for being here today.
Oh, my pleasure. And we were chatting earlier about that. I have a little bit of a vested interest because the more you guys know how to do a televisit, the easier it is on the docs. And I have a suspicion, just like, that probably, this has forced us to adopt tele, and it's going to carry over even after we get over these crazy COVID times. It will be more convenient for other patients, especially sometimes where you don't have to come into the office. You could do stuff from home. So you don't have to necessarily miss school and change your whole day to drive somewhere. You can do it over tele.
Absolutely. I think that, I think a fortunate aspect of this pandemic is that telemedicine has come to the forefront, and it's giving patients more options how to meet with their doctor, and insurance companies, including CMS, like Medicaid and Medicare, are covering the cost. So this really helps with a lot of the accessibility, especially maybe if you are in a rural area. And so you can probably meet with your doctor maybe a bit easier. And so while there is some limitations to maybe a virtual visit, there's also a lot that your doctor can help you with. So we're just going to kind of unroll what this looks like and how to prepare. And we hope that you will ask questions through our Facebook live chat if you have them. Kylie with NephCure is going to jump in whenever you guys have questions. So we're just going to kind of roll with it. So Dr. JJ, let's just start with talking about what telemedicine is. And if you can maybe just briefly tell us, what are some benefits for you as a doctor and the patient with having telemedicine visits?
Yes, and it's always kind of funny because I am not a millennial, so I didn't grow up texting and video chatting because, when I watch my kids, like if I get my kids to talk with grandma, they don't know how to use a regular phone. Like I always have to remind them, you got to talk. But when we do like a video chat through Facebook or Alexa, they're like naturals at it. So I think in some ways me explaining, the advantages of tele to the millennial crowd is a little bit, it's a little bit funny. But I mean, I think the main advantage is, as doctors, we want to be able to see you regularly. We want to make sure that we're taking away from your normal life the least amount as possible, especially patients with chronic diseases. They don't want to be coming into the doctor all the time. And that's, I think, the huge advantage to tele is often first of all, a lot of times with tele, you don't have to go into a doctor's office, right? So you're at home and it can be very convenient. Sometimes you can actually sort of leverage tele, like if your healthcare system has multiple offices. And so like for me, I work at Lancaster, but I'm only there a half a day once a month. I can still have patients come to that office and do tele, and it's even more effective because then I can get vital signs and get them to plot out and get them the scripts they need, and as well as that. So I think that's the huge advantage to tele. It's really the convenience factor. That's the way I would describe it.
So if I was your patient, or even if I was your patient, patient's parent, and I have a visit, or I call your office to schedule a visit and they say, yes, absolutely, we can do telemedicine. What's the first thing that I need to be doing or like looking for? Like what's really the first step?
Yeah, the first step is usually, like, I'll give you an example. What we do here is we then send you a link to either your email or, we generally an email, which you can open on your cell phone or open on your computer, which has you register with the system. That's usually a one-time process that you register. And then depending on what device, there's usually another thing to make sure that you have all the requirements. So it runs through a little script to make sure you have video, to make sure you have a microphone, and then you have enough bandwidth as far as internet. So now a lot of times you might have a computer that doesn't have a microphone or a video camera on it, but most of us have cell phones that are able to do the same thing. So I think the most important thing is for you to, obviously for you guys to, for everybody to register and get familiar with kind of the settings of the app. So for example, if you do it ahead of time, you realize, well, hey, I can upload stuff that Dr. Zaritsky can see. So some of my patients they're real savvy. They'll, for example, if they'll take a picture of a dipstick at home and upload that picture so that when I log on, I see it. Or they have some outside medical records that they can log on. I think as it gets closer to your appointment, one of the great things about tele, which I can't do in the office, is, a lot of times there's confusion over what medicines you're taking and blah, blah, blah. There, you can just take your bottles out and we can go over your bottles right there. You don't have to haul all your medicines in the clinic and we go over. And I think for me, that's probably an advantage over telemedicine than the regular visit. So, but you really want to be prepared so that you've registered and you've gone through all the requirements of the whatever particular app you're using so that you're ready to go.
Yeah, there's definitely some big technology logistics that must be worked out for this to work.
Yeah.
And you're right. So, telemed, I think initially we think of, a video conference like we're doing now. But sometimes people may not have that. And could you do a visit over the phone as well? Do
Yes.
you have to have video conference?
So, with the COVID times now, the things are being a little loosened, because they don't want patients coming in. So it is possible to do a visit over the phone. I would guess that right now, though, the video camera is so ubiquitous, especially with our cell phones, is that we really kind of encourage, we want to see you. We want to, it kind of engages the person a little bit more when you do the visit over tele for whatever reason. I think the millennials really understand that. What I find happening is also like, usually the kid ends up helping the parent to make sure they get all the technology up and running. So, but like, the most thing is you want to get everything right. So now, sometimes I run into someone, I can't hear them, but I can see them. So then I'll call them on their phone and we'll do it that way. But usually this is it's a kind of a nice way. And then I can actually, especially for some of the stuff for like nephrotic syndrome, where they can show me how swollen they are. They can show me what their dipstick's doing. And like I said, for me, I'm a big fan of the medicines where they show me the bottle and I can say, oh, that's expired. You should throw that out. Or, oh, I see we've changed the dose. The label doesn't reflect that. Let me send you a new prescription. So when you pick it up, the label's corrected. Definitely.
That's a safety issue. So beyond the technology part, I think that lighting is probably a big deal, right? Especially to make sure that you can see them, especially if you're wanting them to show you, their face, see if they're
we have like a real life, you're optimized, I'm not, right? So, I always tell, you want the camera up a little bit higher, and then you want to make sure that, that there's not light coming down like this, but it's better when the light kind of reflects. So a lot of times people put a little light behind the camera, and then they'll put like a I don't want to get too technical here, but they'll take like a white piece of paper and put it here so that it reflects some light. See that?
Yeah. So the way my home office is set up I have a big window right behind my computer. So I do have some of that natural light.
Yes.
I think sometimes people's homes can be a little dark. So, if they have a good Wi-Fi signal or even their cell phone, they can take it outside to have a better lighting, especially if you want to be able to see them and really kind of get a good assessment, especially if you're going to be, looking at something else besides their face, right? If you want to look at their legs, or their feet, if there's some type of area that's of concern, good lighting is obviously a good thing. Flashlights are good. You can always use the light on your cell phone on your smartphone if you need to, but definitely good lighting can help. So what are some other specifics, like patient prep to have, like when you meet with your patient, right? Like what would you, in an ideal situation, what can we do to mimic the best from what we would do in your clinic?
Yeah, I think for what's nice for the patient is if they've, especially the parents, if ahead of time they've kind of written down some questions that they want to answer, because it's always, and I think that's great for a regular visit, and what you could try to do is go through the main steps, other than setting everything up and maybe having your meds ready. Think about how you'd want to optimize that you have that doctor's, you have that doctor's full attention. How do you take advantage of it? I think that a lot of times writing down some of the questions before you come to the office is extremely effective, because we've all been there in the situation where you're, oh, hi, how you doing? And then you're like, oh, I forgot to ask this. I forgot to tell them this. And then also to jot down some brief notes during the visit. I will tell you that most of the telemed solutions have a way of me communicating to the patient instructions. So especially if you've registered with the system, right? I can say, hey, at the end, I want you to go over these instructions that I've written out for you. And I think that's also important. But coming to me with the questions you have, and having a chance to kind of, jot down whatever you want to as the appointment's going on. A lot of times it's also, the other nice thing about telemed is that, a lot of times what you can do is, even though people are in disparate locations, like let's say mom's at work, let's say it's a dad visit. And I can say that because I'm a dad, the dad takes the kid to the doctor, and, a lot of times we're not up on all the details. And then you go home, and then the mom at dinner goes, well, how did the doctor's visit go? What did the doctor say? And I go, it went great. And well, what the doctor said? The doctor said everything was fine. No, what do you mean everything's fine? So another advantage of tele, if you really want to take advantage, is that you can invite other people. So if your mom's at work, or maybe your dad's the one at work, you can invite them in. So you can have a virtual kind of Zoom room or something. So everybody's there. Everybody can get their questions answered. Like I said, preparation, it's like anything in life, you want to be prepared for what you have. I would also have all your meds kind of lined up in front of you. Yeah. So you have them there, you know what's going on. And sometimes it's nice because you can then show the doctor, hey, I use this pill box. This is how we keep track of the medicine. Those are all nice things to let your physician in on, I think.
Yeah, absolutely. It helps with, kind of assessing medication safety, right?
Yes.
For sure. So, being that we are doing this through NephCure, although I think a lot of telemedicine points that you're covering definitely can be applied to the general audience outside of nephrology. But as far as a nephrology visit, right? If we're going to be looking at nephrology, I know, I'm a patient mom. My son has nephrotic syndrome. I know what are those things when we get there, the first things they do is they weigh him, they measure his height, and they want to, get his blood pressure, right? They get his vital signs. And while we may not be able to do all the vital signs at home, I think a lot of our kidney patients do have blood pressure machines, right?
Yeah.
And so are those also things that you would want them to maybe have on hand?
Yeah, I think the one of the things is that most of us have a scale in the house, and I think a lot of patients with nephrotic syndrome have gotten used to weighing themselves. Do you know what I mean? They just get used to doing it. So I think having a trend of your weights and weighing yourself that day is important. A lot of the patients, if you really want to get fancy with your doctor, a lot of nephrotic patients have dipsticks at home. So even if they're in remission, it's kind of nice to dip, and then you can actually show the dipstick and show it to the doctor and say, hey, look, no protein, which is something that I think the blood pressure, it's great. We like to, a lot of times if the blood pressure is abnormal, repeat it, what we call manually, or the oscillatory method. But the more data you can give us, the better off, the more, it's just like having any amount of information. So if you can give us some quality information, it works up. And I think that's the real idea of being prepared. I guess, sometimes we say, oh, hey, what's different between tele and this? But a lot of the things that you'd want to go to your regular doctor's visit prepared, meaning your medicines, or you have a list, what questions you want to answer. You make sure you're going to ask your doctor for any supplies. You're going to do exactly the same thing over tele. And you don't want to just get there and oh, hold on, doc, I'm going to go run to the bathroom and go pick up my stuff, or take me into the bathroom. We don't want any. So we just want the stuff ready to go. I think like I said, I would recommend that each patient take advantage of this time and do a tele visit with their doctor, because I think they'll be pleasantly surprised. And then what can happen is that, although we do want to see you in the office, you might say, hey, let's say I'm seeing you twice a year. Well, one of those visits is a tele visit. So, and the nice thing for the doctor, I'll let you know all the secrets, is I'm willing to see a patient at tele, 4:30, 5 o'clock, because I'm sitting here catching up in my office anyway. as opposed to down in clinic, because, you know, I can multitask a little bit better. And if someone doesn't show up for the appointment, I don't feel like I was sitting in clinic till 5 p.m. So a lot of times that way you don't have to miss school, which I know kids don't like doing.
Yeah.
And the parents also can be there. So I think it's a unique opportunity for us to use a little bit more of tele. Tele can't replace everything, but especially once you get to know a patient, the patient gets to know you. And I'll just say, you can also ask your doctor, say, hey, is it possible to do tele where I go to a local doctor's office? So a lot of healthcare facilities, like for example, if I have a patient who lives down in Dover, well, they can do a tele visit in the Dover clinic. So there they get the UA, they get the weight, they get the blood pressure, they get the lab slips, they get everything they want, but I don't have to be there and they don't have to drive 2 hours to see me. So I want you to think of tele as being able to kind of leverage the normal doctor's visit.
Yeah, like think outside the box, right?
Exactly.
So NephCure gets a lot of questions from people, especially recently with the COVID health crisis, about safe social distancing.
Yeah.
How do I, or should I get my routine labs done?
Yeah.
And then so kind of would love your thoughts around lab work during COVID, but also let's think kind of beyond, right? We all know that COVID is not going to last forever. So when people's states and, you know, maybe even smaller sectors of their state start lifting some of the stay home guidelines, for these nephrotic patients who may be on immunosuppressant drugs, what are your thoughts around guidelines? Like, what are you telling your patients? How are you guiding your patients on, you know what, even though the guidelines are lifted, you should really stay home longer? Like, what are your thoughts around labs and when they start lifting guidelines?
So first of all, I'll just preface saying I'm not an immunologist or an ID specialist, right? Because I'm not. And then I'll also preface this by saying that what makes COVID so, I guess, difficult, or kind of, you know, gets us all on edge, right? You know, is that there's just so little known about it, right? We understand the flu, we have the vaccine, we have, you know, antivirals that work with the flu. We kind of have an understanding or an acceptance of the flu. With COVID, we really don't fully understand it. So for example, if we look at the proportion of children that get COVID, you know, you hear some horror stories in the news, but for the most part, children are relatively protected from COVID. We don't understand why that is. And then if we look further at patients who are immunosuppressed, we do not have great data as to how they're going to be affected by COVID. So you can imagine a couple scenarios where, well, it's an infectious etiology. You're going to get sicker with COVID if you're on immunosuppressants. But the flip side is we recognize that some people who are suffering from COVID, there's an overactivation. Like we talk about, like some of the proposed medications, how can they work? Some of the proposed medications are actually anti-inflammatory. So I think the bottom line is we're all giving educated guesses. I think, though, the best way for everybody is to basically try to stay away from COVID. And I would say that we don't want anybody in the family getting sick with COVID. So I think a lot of the things are kind of common sense stuff that, you know, you really, if you don't right now with this huge infection, if you don't need to go out, don't go out. And so even with labs, it's a conversation you have with your physician about, you know, how badly do you need those labs? Could you wait another 3 months? Another thing you can ask your lab or ask your doctor, for example, what we set up here at Nemours is a special time at the lab where our immunosuppressed patients come in. So we've set aside that time for them so that we make sure that there's not crowding, that so there's a specific time that our transplant patients will come in. So I mean, that's the basic premise. I would kind of say it's sort of like, if you just don't listen, none of us want to get sick, right? And none of us want to suffer that way. And so it's worth your while to try to avoid getting sick. We'll have a lot more, you know, it's hard to answer a lot of these questions right now. We'll have more questions in a year. Hopefully we'll have a vaccine and we'll have all this stuff and we'll have a better understanding about who's getting sick. I will mention that, you know, anytime you have a relapse of we just don't want you having you might say, well, maybe I should come off my immunosuppressives because I don't want to see what's going to happen with COVID. Well, we don't know if the immunosuppressants help or hurt. But I can tell you one thing is that having a relapse of your nephrotic syndrome sets you up to have other illnesses. And so most of us as doctors, we kind of, in our head, we're balancing the risks and benefits of the immunosuppressive. So it's a conversation you want to have with your doctor to see, hey, where is that balance set?
Yeah.
And most of us are,
yeah, but never stop your meds, right?
No,
I mean, like, you need to talk to your doctor for sure.
No. So for example, sometimes we have patients who need a Rituxan infusion or a rituximab infusion. Well, should we give it to them in the COVID times? Well, here, at least the group of doctors I've worked at, we've said, hey, we do not want these patients relapsing, or we want to keep them in remission, because if they're not in remission, then they're in the hospital, they're getting more exposures. Who knows what happens if you have active nephrotic syndrome and you get COVID. So that's kind of the thought process that goes behind everything. So, but yeah. I think tele is a perfect example. Hey, if you don't need to go in the doctor's office, do a tele visit, and then ask your doctor, hey, do I really, do I really need these labs? Can they wait a month? Do I really need the tacrolimus level today? Can it wait a month or two until things have kind of quieted down? I think it's where real common sense starts to come into play.
Yeah, and I think you brought up a good point that if you do the labs in the physician's clinic or in the hospital system, obviously try to do that in a time where they're dedicating to maybe some immunosuppressed patients. If you're going to a lab that is a more private lab like Quest or LabCorp or some of the others that are out there, maybe the beginning of the day, not at the end of the day, right? Yeah. And then ask them, maybe they have specific times out there that they are seeing, patients that have more chronic illness, so that we can try to stay as healthy as possible. So I think those are great suggestions. This has been really helpful. What are some of your final thoughts for our patient population around telemedicine? Any final thoughts you might have?
I would say that for the millennials out there, it's a natural, you could come to us and say, hey, well, why haven't you been doing more of this? And I think it's an excellent question. I think, anytime you try, anytime you try anything new, there's always going to be like, if I say, hey, I'm going to change clinic spaces. Well, the check-in changes, you have to be ready for a couple kind of bumps in the road. But my feeling is hey, tele might actually have some advantages over regular visits when it comes to especially medication compliance, and convenience is huge, or just checking in your doctor. So I would say take advantage of a tele visit. Sometimes, like, I'll just give you an example. If you ask your doctor, like, we have the ability sometimes to do tele on the fly. So if you call, sometimes you get a patient, hey, little Timmy's swollen. How swollen is it? I don't know. So I say, hey, well, let's just do a little quick tele visit. Here's my room, pop in the room. I can actually see Timmy, you're fine till tomorrow, or you better come in the hospital. So I would say this is a great, let's take advantage of this time, try out tele, see what type of, see how you can, I hate to use the word leverage, but leverage it in these current times. And then, challenge your doctor later on after the times and say, hey, I really like the last tele visit. Could we think about doing every other visit over tele? So I don't have to come into the office.
Yeah, and I think you brought up a good point, to not forget that sometimes doing a televisit might be easier for a support person to attend with you, right? Yeah. So like you mentioned, both parents being there. For an adult patient, it could be their caretaker, it could be their spouse or partner. So that's also a really great mechanism of support, so that you can have more people there with you when they may not be able to be there otherwise.
Yeah, you can eliminate the proverbial dad visit. Yeah. And like I said, before I get any nasty comments, I'm a dad, so that's going to be my excuse.
No, you know what? I have to say, it's hard because I'm a nurse and I'm a patient parent. And when my husband takes him to visits, I get stressed because I know I won't get the details I want.
Yeah, exactly.
He's a good dad, though. He's a good. Yeah, and I think that, overall, I think doctors and patients will overall really like telemedicine. I think if you go in with a positive attitude and try to be prepared as possible. If you are a nephrology patient, try to get a current weight. If you have a blood pressure machine, get that done. Obviously, showing a dipstick is great. So your doctor can visually see it. Always have your medicine with you in the pill bottles. You can show those bottles right up to the camera, so they can check the bottles and make sure that the dosage and the label is correct, so that there's no confusion. And I think that overall, our doctors are really good at alleviating stress around anything new. And I think that with the current crisis, telemed is a great great option for everyone, not just in nephrology, but everyone to partake in. So in the light of, this COVID risk, I think that it would behoove us to just review, some of those infection signs. I think, just to mention, the most common ones, especially in the adult population, right? Because like you said earlier, kids seem to be a bit more resilient against the infection, or if they do get it, they tend to be more asymptomatic. So everyone's probably heard is the short of breath, the chest pain, fever, chills, maybe a cough, some nausea, vomiting. It seems that, the symptoms tend to be different for a lot of people. Some have GI symptoms, some don't. Some have some anorexia, loss of taste and smell, and some don't. But I think overall, right, and I think that you could probably, push this home too, is that it's just really important to follow those CDC guidelines of physical distance, hand hygiene, staying at home, right? And if you do have to go out, to wear a mask or some type of face cover to really cover your mouth and nose.
Hi, Kristen. Just jumping in here. It's not really a question, but I want to read what Kelly wrote on Facebook. She says, "Thank you for this. My daughter's appointment is scheduled for the 29th. I'm assuming it will be canceled, so this is a good solution for a quick check-in with her nephrologist."
Absolutely. I think that this would definitely, I think that you should, Kelly, I really think that you should look into telemedicine. Just as Dr. JJ was saying, it's easy, it's friendly, and they can get a lot of their work done, teleconference. So I hope that you do bring that up and not cancel the appointment altogether, because it sounds like you can get your visit seen with your doctor, through telemed. Any other questions out there?
I think that's it on the Facebook side of things.
Okay.
Thank you.
And if you have questions as you're watching this, we will be posting it. It's recorded, so it'll be posted there. So if you have questions as they come up, feel free to ask them. Myself and some of the other NephCure staff will be happy to get back with you. If there's something really pressing, I know that we have access to Dr. JJ. He's always willing to help out and answer questions if needed. But thank you so much, Dr. JJ, for being here. I really
I gotta tell you a joke. We gotta end with a joke.
Sounds good.
You ready? Okay. What's the difference between a well-dressed man on a bicycle and a poorly dressed man on a tricycle? A tire.
That was a good one.
The jokes are just as bad. That's the perfect. The jokes are just as bad over telly,
Oh,
my delivery improves, right?
Oh, that's good. That's good. Well, thanks so much. Again, stay safe, stay healthy. Thanks, Dr. JJ. We appreciate
My pleasure.
your time.
My pleasure.
All right. Bye, guys.
Bye. Okay. Well, anytime I can help.